Hello everyone, my name is Osafona Victor Dobo. This is a NAC OSCE tutorial video on combined oral contraceptive pills counseling. I'm going to be starting with our scenario here. You have a patient, Mary Fox, a 30-year-old patient that had made an appointment to see you at your clinic. And what you are expected to do is to take a focus history and address the patient's concern. So you're going to be starting your history by greeting the patient and introducing yourself, stating your name and your role. And you want to confirm the identity of the patient. You want to know the patient name and age, just to be sure you are speaking with the right patient. Then you move ahead to identify the reason the patient has booked the appointment. You want to know the preventing complaint. And the patient tells you that she is interested in going on the oral contraceptive pills and she would like to know everything about them. So bear in mind that in this case we're going to be talking about sexual history and talking about contraception. It's important that you offer confidentiality to this patient, just to put the patient at ease and let the patient know that everything that you're going to be talking about in the consultation will be confidential. In the history, we want to know, why does this patient want to learn about oral contraceptive pills? What does the patient know about oral contraceptive pills? Is there any particular reason the patient is interested in going on oral contraceptive pills? For some patients, they may be interested in a particular medication because their relative is using it or their friend is using it. So we also want to know, is there any previous or present use of oral contraceptive pills? If yes, was there any side effects? Does the patient have any intention of getting pregnant anytime in the future? If yes, is there any particular time frame in mind? Any chance the patient is pregnant now? Of course, pregnancy is an outright contraindication to contraceptive use. Is the patient in a monogamous relationship or not? Does the patient practice safe sex? And by safe sex, we mean consistent use of condoms. How is the relationship with the partner? This is just to rule out partner abuse in this case. Then for going on to the O and G history, you want to know the last menstrual period. Is the period regular or irregular? Any pain during menses? Is there any intermenstrual bleeding or postcoital bleeding? To rule out any abdominal bleeding. Any previous history of pregnancy? If yes, you want to know the gestation, is there any number of term births, preterm births, abortion in the past, or number of living children if the patient has given birth before. Then you move on to rule out contraindications for the use of combined oral contraceptive pills. Now, what are the contraindications? You have current pregnancy. Very important to rule out pregnancy before starting. Then, is there any history of undiagnosed vaginal bleeding? Does this patient smoke? Any patient that is 35 years and above that smokes more than 15 cigarettes per day cannot be started or should not be started on combined oral contraceptive pills. Has this patient been diagnosed with hypertension or diabetes in the past? Does the patient have migraine with aura? Any previous history of deep venous thrombosis, pulmonary embolism, stroke or MI? Is there any history of breast, uterine or ovarian cancer? Any liver problem like hepatocellular adenoma or liver cirrhosis? All these are absolute contraindications for the use of combined oral contraceptive pills. So it's important to rule them out in the history. Drug history, you want to know if the patient is on any medication that will reduce the efficacy of oral contraceptive pills. like anticonvulsants or rifampin. You also want to know if there's any family history of liver disease, deep venous thrombosis, breast cancer, uterine cancer, or ovarian cancer. Does this patient smoke or use alcohol? Does the patient use recreational drugs? How is the diet? Does the patient exercise? Then you go to 5. Or does the patient have any fear about using oral contraceptive pills? What's the patient's idea of an ideal of a good contraceptive method? What does the patient feel about taking medications every day? What are the patient's expectations coming to the clinic today? Physical examination, we want to check the patient's blood pressure as well as the patient's body mass index, the BMI. These are very important for any patient that you want to start on combined oral contraceptive pills. Combined oral contraceptive pills contain 2 hormones, estrogen and progestin. There are 3 different formulations that are available. The most common formulation that we use is the cyclic formulation, which comprises of 28 tablets, and you have 21 active pills and 7 hormone-free pills. The active pills are the ones that contain the 2 hormones. Patients that use the cyclic formulation usually would have their menses every month. For the extended formulation, patients usually see their menses once every 3 months, whereas patients that make use of the continuous formulation have their menses once a year. In terms of mechanism of action, this contraceptive works mainly by inhibiting ovulation. Then for efficacy, with typical use, combined oral contraceptive pills have a failure rate of about 7%. And what this means is that 7 out of 100 women will get pregnant with typical use of oral contraceptive pills. Then in terms of return of menses, after stopping the combined oral contraceptive pills, most women usually would commence their menses within 30 to 90 days. Then you move on to talk about advantages and disadvantages, the pros and the cons. For pros, you have decreased anemia. There's decreased risk of anemia due to regulation of the amount of blood that is lost with menses. It also helps to improve acne for patients that have acne. It reduces the risk of benign breast disease and ovarian cysts, and also reduces the risk of ovarian and endometrial cancer. Patients that use oral contraceptive pills also experience decreased pain during their menses. Then for the disadvantages, the patient has to take the pills every day. Common side effects include nausea, vomiting, breast tenderness, and bloating. But these symptoms usually would resolve within 3 months of using it. You have to highlight to the patient that oral contraceptive pills does not protect against STI. And there is increased risk of blood clot formation, such as DVT. It is advisable that patients should stop smoking if they smoke and try to control their weight by exercising and diet control. The patient can start the pill on the same day that the prescription is given or within the first 5 days of the next menses. It's important that patient takes the pill approximately the same time every day to enhance efficacy. And you can advise the patient to place the pill near their alarm clock or near their toothbrush to aid remembrance. For missed doses, if a single pill is missed, the patient should take it immediately he remembers, then take the next tablet at the usual time. If 2 or more pills are missed, then the patient should take the remaining pills at the usual time and use backup contraception for the remaining part of the cycle. You want to check the patient's understanding at this point, or if the patient has any question. Thank the patient and offer leaflets about oral contraceptive pills. To summarize, for this case, you want to do a quick history where you identify the reason why the patient is interested in oral contraceptive pills, and you also want to rule out contraindications for combined oral contraceptive pills use. After doing that, you educate the patient about combined oral contraceptive pills. You tell the patient about the different formulations, talk about the advantages and the side effects, and then you check whether the patient was still willing to go ahead with commencing the pills, or the patient wants to go back home and think about it. So depending on what the patient decides, that will determine how you move along. It is important that when you're talking about the pills with this patient, that you always check the patient understanding, carry the patient along instead of just talking continuously for a long time. You do what we call the chunk and check. You give a little information and check the patient's understanding before you go ahead and give more information. Because it's very easy to forget and just continue talking for a long time without checking the patient understanding. So this is a very important thing to be wary about in this kind of scenario. Thank you.